Hi, my name is Madison, and the pathology that I picked was hydrocephalus. For hydrocephalus, you do a shunt series, which includes a PA skull and an AP supine abdomen. So right now, I'm going to demonstrate how to do the AP supine abdomen, or also called a KUB. So right now, for the AP supine abdomen, I'm going to use a large focal spot, and for the PA Caldwell skull, I'm going to use a small focal spot. So when I bring the patient in, I'm going to make sure that I close the door, and I'm going to ask them 2 patient identifiers, which can be name and date of birth. Next, I'm going to ask them a little bit of history, starting with, which we have a female patient here, if there's any chance of pregnancy, and when was their last menstrual period. Next, I'm going to ask indications about why they're getting this x-ray done or why they're getting these exams done. Indications can include injuries, pain, previous surgeries, anything that could indicate why we are doing this exam. Next is chronology. How long has this pain or injury been going on for? Location, where it is that the pain is or where the injury is. I'm going to check to make sure that there are no artifacts, no metal, buttons, zippers, anything that could be in the way of the anatomy that I'm imaging. And then the last thing is I'm going to change the patient into a gown if there is any metal, zippers, buttons, anything. But in this case, my patient does not have any reason to be changed into a gown. Alright, next I'm going to shield the patient, so I'm going to shield any radiosensitive tissue. In this case, I'm going to be shielding the patient's gonadal region. So with an abdomen, I'm going to try to get the shield as close as I can, but so that way it's not in the image. So I've now shielded the patient. I have a 40-inch SID. I'm going to pull my image receptor out here. I have a 14x17 image receptor, and it is lengthwise, so the length of the patient, making sure that we get all of the abdomen on that image receptor. I'm going to stick this back in here, making sure that it goes all the way in. And then next what I'm going to do is I'm going to palpate for the iliac crest. So iliac crest on the patient here. I'm going to make sure that I have that centered. That red line right here is going to be right where I'm going to center at that iliac crest. So I'm going to kind of move the patient here, and there is the iliac crest right there. You also, if you end up moving the patient, you might want to move the shield down if it's in the way. Also making sure that you are centered to the midline of the patient's body, so the mid-sagittal plane. It looks like I'm pretty centered right there. Once again, I have a 14x17. I'm going to put a marker, have the patient centered where they need to be, and I have them positioned the way I want them. I'm going to stick a right marker on the right side of this image receptor. Stick it in the corner here, making sure that it's not in any anatomy of interest. Since this is a 14x17 image receptor, sticking it here should be fine. I'm going to stick this back in here. Once I am done positioning and I'm ready to make an exposure, I'm going to grab my calipers here, and I'm going to measure the patient, measure the body part that I'm going to be imaging. So I'm going to stick these calipers, making sure they're right under the patient, and then making sure they are going through the central beam where the beam is entering and then where the beam is exiting. So I'm going to pull these out, and the patient measures 24 centimeters. So I'm going to look at my chart here, and for 24 centimeters I would set a 87 kVp, a mass of 24. Again, I would have a 40-inch SID, and this is a table Bucky exam. And that is how you do a AP supine abdomen. Alright, so next we're going to be doing the PA Caldwell skull. So I have the patient seated erect, facing the image receptor. What I'm going to do now is I'm going to put the shield behind the patient. So I'm going to kind of drape this behind her, have you scoot forward just a little bit here. Yep, sit back. Alright, so I have my image receptor lengthwise in a wall Bucky. I'm going to stick this back in here. So with the PA Caldwell skull, I'm going to have the patient put her forehead and her nose up against the wall Bucky here. And I want her OML, her orbital meatal line, to be perpendicular to my image receptor. So what I'm gonna do is I'm gonna come up here and I'm gonna look at where her ear and her eye make a straight line, perpendicular line to the image receptor. So I'm gonna come up here and make sure that that line is straight here. That looks pretty good. I'm gonna have you bend your head down just a little bit. There you go. All right. That looks perpendicular right there. I have a 10 by 12 portrait, so I just want to make sure that I have all of the top of the skull, all of the sides, and all of the soft tissue, and that I'm not cutting off anything. So I'm going to ensure that your central ray exits at your glabella right here, the bridge of your nose. So I'm just going to make sure. So I'm going to make sure that is centered and that is lined up. I'm also going to move the patient's take the patient's hair tie out here, just because that could show up as metal. Back to you. So I'm going to make sure that she is centered front to back here, and that it's going down her mid-sagittal plane. She has plenty of light at the top and on the side, so I am going to collimate down just a little bit. So I'm just collimate down a little bit here. And we're still lined up and everything right here. And I would also have the patient take out her earrings too, just so that way the metal won't show up. So next I'm going to mark the right side of the patient's body once again. So I'm going to stick my marker in the corner here, making sure that it's not in any of the anatomy of interest. And then I would go grab my calipers now that I am ready to make the exposure. So I'm gonna come over here, calipers. And I'm gonna measure from where the central ray enters to where it exits. So from back of her head to her glabella here. And the patient measures 17 centimeters. So I'm gonna look at my exposure chart here. And it is going to be at 17 centimeters. It will be set at a KVP of 80, a mass of 12. I will have a small focal spot. Once again, I'm at 40 inches for an SID, 10 by 12 image receptor, and I'm in the Wolbachie. And that is how you do a PA Caldwell skull.